there's me. So this, between these two pictures, the only thing that I did was Ulthera. I've done other things before, I kind of alluded to that. But between these two things, I really wanted to evaluate the machine and see what it could do. And I was 40 when I had it done. So you can see that I had some early laxity here and a lack of definition in the jawline. And I just looked tired and sad. And I have 2 kids, and I often am tired. No, I often am tired. But I was just as sleep deprived this picture too. And it was that was 3 months later. And it really did change the texture of the skin. It tightens the pores, and you get that improvement in the surface and that deep tightening effect. So I've been, you know, that's my story with Ulthera. So this is Leslie, and she had fillers before, but all of her fillers had been placed low on the face. And she was perceiving a loss of volume here and lower down on the face. She was seeing the shadows and lines there. And that is, when done subtly, it's okay to kind of chase the lines a little bit, but my preference is to put the volume where it belongs on the face, and you can see that it looks very, very natural. So by putting that volume here and in this part of the face, it lifts up this part of the face, and we lose the depth here, and it picks everything up. So it looks, because that's where the volume used to be, putting it back up there is restoring the scaffolding, restoring the structure that used to be there, so it looks like your face used to look. It also makes you look more slender. It picks this up through here. I mean, that's my goal with it as well. That's why I did it.
Well, anything, you know, it's like wearing big shoulder pads. I like that diet because it makes the hips look smaller. But no, I mean, I just feel better. I'm 46 years old, but I don't feel 46 inside. And I go out, I have some really good friends who are sort of in their 30s, and I go out with them, I don't want to feel like their mother or the old lady, you know, sort of, you know, the sort of the driver or something. And I don't want to try and look 30, but I just wanted to look vibrant and younger and fresher. And when you actually told me about putting it up here, that shocked me, but it made such sense. And I just feel happy when I look in the mirror now.
The product is Juvederm Ultra Plus, and it typically will last, the product labeling is 9 to 12 months. What I'm finding where this is done, somebody asked me earlier where it was done, and I made a joke about not telling all my secrets, but it's actually done underneath the lining of the bone mostly. It's done very, very deep, and I'm finding that in that plane it seems to last a little longer for people. 14, 15 months is not unusual that'll last, so it's lasting a long time for people. Donna was gorgeous when I met her, and she's even more gorgeous now, I think. But she had, what concerned her the most when we met was her forehead. And we've done lots of things over the years to try and restore and lift. We actually, originally we did a brow lift, and we were less than satisfied, and that's because it was before for a long time, we've all known that we lose volume, but everybody put the volume in the cheeks. It's only when I started putting the volume where it actually belongs on the forehead that we were able to make this difference for. And it really does change the facial harmony. And like I said, I already mentioned about her nose, but if you look at her picture, the reason why this part of her face and the lower face looks more prominent is because of the volume loss that's happened around it. So the rest of the face recedes back and everything else because it looks more prominent. So we've given her better shape to her brows and better shape to the cheekbones, and it gives her better facial harmony. We can see that we've restored the volume to the cheeks. We've also done Trinity. We've done the restoration of collagen and elastin in the skin, and you can see that, it's gone now, but the texture of her skin is much, much better than it was 7 years ago because we've removed damage and we've resurfaced the skin, and we've done that Ulthera treatment to her jawline as well to give her that better tightening through here. So we're tighter through here and lifted through here. Do you have anything to add to that? Or?
No, she's just the most wonderful thing ever, and she does customize the treatments to what you need and wouldn't do the same thing to everybody here, and that's what I love about her.
Carol was lovely before we started. She's even more gorgeous now. But this is just Ulthera. She's had no filler. So by tightening the deeper structures that have had some early laxity, that has restored a lot of harmony to her face as well. So it's very powerful. What was bugging you before? What made you do this?
Well, what really was bugging me was my face was falling. And, you know, you wake up in the morning and you're washing your face and it's like, oh. And then you're using makeup. And it's like you're gobbing it on because you're trying really desperately to make yourself look like you know, you're still in your late 30s. You know, so my goal was always, you know, at 37, I realized I was approaching 40 and it scared me. You know, so, you know, being able to now look like I'm still maybe in my early to mid 40s has just been such a treat. My skin feels so much tighter. I wear less makeup. It just does a lot for your self-confidence and a lot for your self-esteem just to look in the mirror and see, here, that's the way I remember I looked.
How permanent, or can you talk about how?
It is setting back the clock.
Yeah.
So it's tightening, it is leaving the structures where they belong. It's not surgically changing them, but it is tightening them to the shape that they used to be. The studies that were done and the people who've had the machine longer than I have, frankly, are finding that it lasts about 5 years. So something that has no downtime and doesn't burn a bridge, that can give you 5 years of tightening is pretty nice.
Yeah, that's right, the no downtime. It took, what, maybe an hour and a half to 2 hours, and then I went back to work.
Honestly, you know, I thought people thought I looked a lot younger than what I am, and but when she went from looking already great, but now looking 10 years younger, it did. I felt kind of odd. So I said, okay, fine. I'm going to be one of those guys that dares do this thing. And everything they say is true. It is uncomfortable to have it done. It lasts about an hour and a half maybe. And when it's done, you immediately don't feel anything other than maybe a little bit of tightening. And it takes months for it to really kick in. And so you're almost going to say to yourself when you look in the mirror, I see no change, I see no change, until you see that. And that was taken, the after picture here, I think, when was that taken, Megan? About 3 months ago?
The after picture is right at 3 months.
Yeah,
So.
and that was 3 months ago. So a lot has happened since then, and you can't really tell with a photograph exactly what's going on, but it does document it, and it's been pretty amazing.
It almost looks like you've had filler in your cheeks because this was so much longer before, and now that it's shorter, you've got your cheeks back. Which is a much more youthful profile. That's part of what's going on. It's all a combination of things, but you actually almost look like you've had a little bit of filler there and in the brow, so, and that lifting effect.
And I wondered where my cheeks went.
We're going to be doing a restoration on her lip. She's 25 years old, so she doesn't have a huge amount of volume loss. But she's built with small lips. And many people who come to me who have small lips are afraid of doing this because they think I'm going to make them look like Angelina Jolie. And my answer is you have to beg me 3 times before I will make Angelina Jolie lips. Because that's not the goal. The goal is to give you a little enhancement, a little more show of the red lip. So what we're going to be doing today is a nice subtle enhancement of her lips. And before we came up here, she had a block done. It's a dental block that we do very, very delicately. I'm allergic to pain. I assume my patients are too. Can you smile? There you go. There you go. You don't have to keep smiling. There you go. Just fine. And the product itself is actually mixed with local anesthetic now. So it keeps it nice and numb. And the numbing medicine will wear off in about an hour. When we're doing Botox or Dysport, we use a numbing cream that if you leave it on for about 10 minutes, that doesn't hurt either. So we don't have to do blocks for everything.
All right, I think Brooke deserves a round of applause on that. And Brooke, before you sit down there, I've got another mic right here. Could you just talk about that briefly?
I don't know if that's fair.
Did it hurt?
I didn't feel not one thing.
Okay, and what do you
The
think?
only reason I knew she was doing it because I could taste it. But I could taste when she would start doing it. It was like dripping a little bit. I mean, it doesn't taste awful, but that's the only way I knew you're doing it.
She didn't speak Southern before this happened. That was the only thing. I'm just saying.
Good job. Thank you. I'm allergic to pain. I'm a wimp, so I know what all this feels like, and I'm allergic to pain. We use numbing cream, and it's very, very effective if you leave it on long enough. 10 minutes is usually enough. When we're doing stuff around the mouth, if at all possible, we do a block so you just don't feel any of it. I want to make it comfortable. I don't want anybody not doing this stuff because they're afraid of the pain, because we'll do everything we can to make it more comfortable. Same thing with the Ulthera. It is delivering energy to your tissues. So know that I think about those things, and it's my goal to make things comfortable for you, and we find ways to help you get through stuff.
Contact Dr. Meghan McGovern at Coastal Empire Plastic Surgery today to learn more.